From the News Channel 5 Network, this is OpenLine.
Good Monday evening, everyone. I'm Carrie Sharp, and welcome to OpenLine. We are midway through September, and I wanted to make sure that you know it is Ovarian Cancer Awareness Month. Such an important topic to spend the hour with you tonight on, and I do hope, whether you're a woman or you have an important woman in your life, that you will just park yourself right there on the couch tonight and really listen to what all the information we're giving out tonight. It could save someone's life, and that is my hope tonight, is that we give some information that truly makes a difference. I have two remarkable ladies here joining me to give you all of that information. Dr. Cabelli from Vanderbilt, thank you for being here.
Oh, it's a pleasure.
And Marcy Huff, an ovarian cancer survivor and now an activist when it comes to raising awareness. Thank you for being here as well.
Absolutely.
You have an amazing story to tell, and we're going to get to that. But first, Dr. Cabelli, I would love to start with you. Ovarian cancer is often called the silent killer. But that may be a little false, it may be a little misleading, not so silent. There are signs and symptoms.
There are. Ovarian cancer has signs and symptoms. Unfortunately, most of the signs and symptoms happen when it's already widespread. So if we could diagnose ovarian cancer at stage 1, where it's confined to the ovary, we would have a 94% or higher cure rate. Unfortunately, most women, 60 to 70%, come to us when it's already spread within the peritoneal cavity, which is the abdominal cavity, and they usually come to us at stages 3 and 4 of disease. So the chance of cure is not as high. And that is why people used to call it a silent killer or silent disease. We now know that women have certain symptoms that they need to get checked out. If you have symptoms of abdominal bloating or swelling, you're losing weight unexpectedly, if you have problems with your bowels or with urination or postmenopausal or irregular vaginal bleeding, you need to see a gynecologist who then could make a referral to a specialist.
We have so much information to get to, but here is something that I want you to know. 1 in 70 women will likely get ovarian cancer, and it is the deadliest of all gynecological cancers. That should make our radar go up. The deadliest because it's diagnosed often so late, and that's scary, because the symptoms you just mentioned can be explained in so many different ways. Oh, I'm bloated because I had a bunch of salt with this meal, or you know, it's that time of the month, or you know, different kinds of, you explain them away.
Yeah, so we're really talking about symptoms that happen persistently over weeks to months. We're not talking about you had too many slices of pizza last night and then you feel bloated the next day. We're really talking about persistent symptoms and alerting people when you have these persistent symptoms. And often women are referred to a gastroenterologist or somebody else who's working up an intestinal problem. So we're trying to get the message out that it's okay to see other specialists, but within that list of people, you're going to go see a gynecologist.
Now, you also said these symptoms may not rear their head until late into the disease. So, and I think this will shock people, there's no way to test for it before that.
Right. Unfortunately, we do not have a screening test for ovarian cancer.
The pap smear does not do it.
The pap smear does not do it. The pap smear screens for cervical cancer. So there's no screening test for ovarian cancer, and that is why research is so important.
And I have to brag on Dr. Cabelli. I got a chance to meet her on Friday and do an interview for a story that you will see later on News Channel 5. But Dr. Cabelli is a bit of a triple threat. She is a doctor, she is a surgeon, and you are a researcher. And I got to spend just a little bit of time in your lab with you and your lab assistant, Andrew, and doing some amazing work. I'm not sure how you fit it all into a day, but can you briefly describe what you're trying to do? What is your goal?
Our goal is to, as quickly as possible, test new drugs in the lab that we can rapidly translate to the clinic, so women can benefit from new treatments for ovarian cancer. So as other labs are working on new ways to detect it and screen for it, our lab is working on ways to make treatments better, so women are living longer even if they're diagnosed with ovarian cancer, and that some of these treatments can be effective without causing as many horrible side effects as our current treatments have.
Because often you hear about what chemo does to a person's body, and it's so hard to go through. Marcy, you know that. You've been through chemotherapy. And so you were telling me the goal really is to find treatment that a person can live with and to tolerate. right?
Right, and hopefully to never have to go through again.
Yeah.
So, yeah.
Exactly.
Yeah.
Marcy, tell me about your symptoms. How did this all come about for you? This was 8 years ago, right?
8 years ago.
Yay!
8 years in remission. I'm truly one of the lucky ones. I mean, when I hear Dr. Cabelli speak, it kind of gives me that thought that I'm one of the lucky ones.
Yeah.
I did have signs and symptoms, and they probably persisted for about 6 months.
Oh, wow.
But I explained them away, just like
what?
you said.
What happened?
Well, I was bloated. Well, I had been eating a Kashi 12-grain cereal. I mean, that will bloat you,
Sure.
right? I had a little bit of lower back pain. Well, I had a 4-year-old, and I was still picking her up.
Yeah.
I had lost a little bit of weight, and I was like, "Yay, I'm skinny!
Finally,
this
I've
is
been working
great."
at this.
Yeah. And I remember having some abdominal, little bit of pain below the belly button. Well, I was doing Pilates, so I had an excuse. I had a reason for all of it, and ovarian cancer was absolutely the last thing that I would have thought it was going to be.
Really, had you ever really thought about ovarian cancer for any reason?
No, I had not. But I was truly lucky. I knew I had these things going on. I decided to go see my OBGYN for my annual appointment because I'd been seeing my OBGYN every year.
Yeah.
And sure enough, they did a pap smear, which came back normal later on. But when they did part of the exam, they felt that there was a need for me to maybe have a scan. So I had a transvaginal ultrasound, and they just determined that there was some kind of a mass on my ovaries. So at that point, they kind of switched gears, and they started talking to me about a total hysterectomy. There still was no mention of cancer. And again, it just didn't occur to me. I then was given a blood test, which is called a CA-125, which Dr. Cabelli can speak to this far more than me, but it basically detects protein in your blood that may determine if you do have ovarian cancer. You have to reach a certain level for that test, and mine had reached a level where there was suspicion. So they switched gears, and instead of having an OBGYN do my hysterectomy, I had a gynecological oncologist surgeon, which is what Dr. Cabelli is. And I must say, this is a huge determination in how well I did. And when I think of other women, it's so important they could get to a gynecological oncologist. I mean, these are the doctors that are seeing this on a regular basis. They're able to do the surgery. They're able to, I mean, as my surgeon said, I was back in Ohio, and he told my husband, we scraped and looked and peeked and everything they needed to do, and I was considered no visible signs of disease, which is huge. Now, unfortunately, because it had spread, I was stage 3.
Oh, wow.
So I was told I was going to do chemotherapy, and I did about 12 courses of chemotherapy, and then I did a type of chemotherapy where they combine 2 different types. One was done IV, your typical IV through your vein, and then I also had the chemotherapy drug administered right into my inner peritoneal cavity. Which I really think that's a huge reason I'm 8 years out. I'm 8 years out. That's where the cancer comes back a lot of times. So it made great sense
Somewhere
to
in
do
that
that.
cavity, yeah.
It's a tougher chemotherapy regimen, but I still remember my husband telling me, "You've got one shot. Got one shot at this," and. Again, we're lucky. We're lucky. So,
and you kind of buck the trend too. A lot of women, 2/3 of women are postmenopausal who have ovarian cancer.
I was on the younger side of it. Although, just anecdotally, I get calls from women that are in their 30s and have this happen. But I think the average age is around 60. But like Dr. Cabelli said, and I always preface this when I talk to women, we don't want you to call up your OBGYN after 5 days and say, oh my gosh, you need to see me right away. I think this is something bad. But if the symptoms do persist, there is the chance that maybe you might be diagnosed at a little bit of an earlier stage. I mean, I understand that unfortunately a lot of times it means it has progressed. But I mean, we hear this all the time as women. Take some time to think about how you're feeling, to not explain everything away. Take 5 minutes to say, is this truly what I should be feeling, or is maybe something going on?
Yeah, we're often the caregivers of everyone else, and we put our health last. Dr. Cabelli, when should you make that call?
Well, I think it's important to listen to your body, and I think that first I've got to say that Marcy is just remarkable in so many ways. She is lucky and she benefited from state-of-the-art care from specialists. And we know from the literature that women who have optimal surgery, so she had a radical surgical procedure that removed all visible signs of the cancer, followed by very intense chemotherapy. That combination of treatment has shown that has proven to be very successful in many women who are at stage 3. And the people who administer this type of treatment are the specialists in my field, gynecologic oncologists, who specialize in both radical surgical removal of the tumor and the administration of this chemotherapy.
And what good news that we have you folks right here in our town, that we can seek you out and find you.
Absolutely, absolutely. And that's very important. It's important to seek out specialty care. And unfortunately, in the United States, only 50% of women are getting this subspecialized care.
Really?
They're getting taken care of by general gynecologist or general surgeon or somebody who's not as familiar with this type of treatment for advanced cancers. And so I think that it's important to get the word out, and I'm really grateful to Marcy for just being so brave and being so honest and real with her story, because I think a lot of people don't feel comfortable talking about what's happened to them. And the fact that you are doing this publicly and raising awareness is going to help so many other women.
And that's what tonight is all about. And
Yeah.
we do have some events that are coming up to tell you about too. We've got a lot to get to over the next 50 minutes or so, so please don't go anywhere. And if you have a question for Marcy or Dr. Cabelli, maybe some signs and symptoms that you're experiencing, go ahead, give us our call. This is the chance to do it. So we'll get those lined up during the break. Stay with us.